ترجع to breastfeed, but to stop all dairy, eggs, and gluten in the diet. And still, it didn't really help. His stools were otherwise normal. He was gaining appropriate weight. He did have severe atopic dermatitis. So what's the best next step? Oh, the slide I think is a little bit cut off. But number one, should we switch him to something like a goat's milk formula, which the mom actually did? تاني حاجة نبعته الالرجist for food allergy testing. Control the eczema, switch to an amino acid-based formula, or control the eczema, continue breastfeeding, and begin early food introduction. Okay, so the term allergy, what does it mean? طول النهار بنسمع إن ابني بنتي عندهم حساسية. What is حساسية? So when we talk about an adverse food reaction, you can either have, number one, a food allergy that's immune mediated, or you can have a food intolerance, which is allocated to the GI tract mostly. And as Dr. Ahmed had alluded to this morning, something like lactose intolerance, where it presents with abdominal pain, bloating, diarrhea. These are classic symptoms. Food allergy, so this is kind of where it gets a little bit muddy. You can have an IgE-mediated allergy, and those are the allergies that we tend to think about, may become a little bit more severe. These children are at risk for severe allergic reactions like anaphylaxis. You can have non-IgE-mediated allergy. فإحنا the most common type of cow's milk protein allergy اللي احنا بنشوفها is non-IgE-mediated or food protein-induced allergic proctocolitis. Things like FPIES, where a patient will eat the food and then present a couple of hours later with recurrent vomiting. These are all non-IgE mediated. Okay. So just a little bit of the pathophysiology. I'm not going to bore you too much, بس احنا عايزين نفهم ليه الالرجي ده بيحصل, and it goes back to a little bit of what Dr. Ihab was talking about happens in the gut. So patients that develop IgE-mediated food allergies tend to have defected barrier surface in the gut, the skin, and in the respiratory tract. اللي بيحصل إن هم بياكلوا الأكل, the food enters, and then it goes through these leaky membranes because again, they're defected surface barriers. بيحصل a cytokine cascade, IL-33, IL-25, PGE2, and these are what we call alarmins because they start alarming the T cells that, hey, something foreign has entered the body. And what happens is your T cells start differentiating and you have B cell class switching to create IgEs that are specific to food. اللي بيحصل إن هم those IgEs are now armed so that the next time the child drinks the milk or the next time the child eats the food, those IgEs can actually go bind onto mast cells that are found in your respiratory system, in your GI tract, in the skin, cause degranulation. And that's what we call the histamine response to cause symptoms. Okay, so again, IgE-mediated food allergy, it's rapid, it's onset. Patients will come in, بيقولوا إن إحنا أكلنا الأكل, and then within a couple of minutes, up to 2 hours, we experienced a reaction. Symptoms, again, symptoms could be very mild or very severe. It all depends on the clinical history. It can go from a little bit of mouth itching to abdominal pain, hives, all the way to angioedema and respiratory symptoms. How do we diagnose it? Clinical history, okay? So clinical history, 100% of the information you need to know, and all of the testing that you're gonna do is in addition. These are all tools in your toolboxes because once you figured out from the clinical history what the child has, then you can do skin testing, you can do IgE testing that does confirm the diagnosis. So basophil activation testing is the other test that's sort of new and on the rise, and we think that this actually may be very applicable to people that have very severe food allergies. So this is another test that you'll probably see in the next coming years. حاجة تانية عايزة أقولها, patients going to do food panel testing. This is absolutely a big no-no. دي حاجة افتكرت إن أنا سبتها في Canada, but when I came to the Middle East, a lot of people in the UAE and in Egypt are doing these food panel testing for IgG. You have some arbitrary, green, yellows, red. I tell patients, لو أكلتوا بيض الصبح, it's very normal for your immune system to actually have IgG to the egg. That actually means your immune system is functioning. So if a patient comes in with this, chuck it out the window. Okay, so why does a food allergy actually develop? So we know in النهاية it's a combination of genetic and environmental factors. طبعا genetic factors we can't really modulate. The fact is some people have an exaggerated T cell response that again starts that pro-inflammatory cytokine release. But the environmental exposure we can actually do something about. And the question is, how early is too early? Well, it's never really too early. A lot of studies show that children whose parents or whose moms particularly have a high fiber-rich diet actually reduces the likelihood of developing an allergy. And this has to do, again, with decreasing that cytokine cascade that happens when you activate those T cells. So this actually led to a cascade of studies, but specifically studies looking at what happens when we introduce foods early. So this is the most monumental study that has probably happened in the last decade. It's the LEAP study that was done by Dr. Gideon Lack in the UK. And what he actually did was he took 640 patients that were high risk. High risk he defined as they could have moderate to severe eczema, and they had a history of egg allergy. He gave half of them peanut early, and half of them he didn't. The ones that he actually gave peanut too early were 5 times less likely to develop allergies versus those that weren't eating peanut. That's a pretty impressive number. طبعا the LEAP study is still ongoing. العيال دي دلوقتي 10 years out, and he's looking at those who were eating peanut and were not eating peanut. And again, it's completely life-changing. I mean, the ones that weren't eating peanut, here they are carrying their EpiPens, etc. So it makes a huge difference to introduce foods early. طبعا this started a cascade of research around early introduction of other foods. The PETITE study done by Natsumi in Japan, what he looked at was introducing egg early. What does it do? It lowers the IgE to eggs. So where does this take us today? Well, actually, the American Academy of Pediatrics in 2000, long time ago, basically used to say, okay, wait till you introduce cow's milk, wait a year till you introduce eggs. We had all these arbitrary numbers. However, we now know, based on this research, that actually introducing foods early can actually be preventing life-threatening allergies. So I'm going to touch on 3 clinical pearls that I want you guys to sort of take home, and hopefully they will be somewhat helpful. Number 1, start identifying the high-risk children in your practice. Who are the kids with atopic eczema, atopic dermatitis that's not well controlled, you know, they have secondary bacterial infections, the ones with egg allergy, the ones with a sibling with food allergy. So oftentimes I'll have a kid come in with me, he has a milk allergy, بس ببص للأم على الولد التاني وهكلمها على his younger sibling, because we can prevent food allergies in the younger sibling if we introduce the foods early. Family history of atopy, allergic rhinitis, asthma, eczema, all of these things should be trigger bells. I'll be very honest, every patient that comes into my office, they are all asked, have you introduced foods? And have you introduced the allergens early, regardless actually of the risk factors? Managing the comorbidities. دي أكتر حاجة بتinterfere, especially in the kids that have severe atopic dermatitis. They often present like this with, again, perioral dermatitis. I had a patient last week, دكتورة أنا أكلته بامية, and then after that, he had a little bit of redness around the mouth. Yeah, well, it's not actually from the bamia, it's not from the tomato sauce. It's actually because your child's eczema is not well controlled, so it comes into contact with anything that's citrusy, and he's gonna get this rash. So one of the clinical things I always say is, number 1, control the eczema. But number 2, if you're not really able to control the eczema then and there, use a little bit of Vaseline or petroleum jelly around the mouth to protect the defected surface. تاني حاجة بقول للأهل إن food allergies are not causing the eczema. دي أكبر حاجة this is the biggest misconception in children that have eczema. It's actually not caused because of a food allergy. It's caused because of a genetic mutation in the filaggrin that holds the skin cells together. Children that do have eczema, yes, are at a higher risk of having food allergies. Yes, higher risk of having asthma. Yes, higher risk of having allergic rhinitis, but the food allergy is not actually causing the eczema. And we know that these children present early on because, again, atopic dermatitis is usually the first sign in what we call the atopic march. So the atopic march, you have atopic dermatitis that usually peaks within the first 12 months, followed by food allergy, allergic rhinitis, and asthma. ثالث حاجة, to introduce the foods. So how are we introducing the foods? We're going to introduce them early. Between 4 to 6 months, you're going to introduce them early and keep them in the diet. Keep them about 3 times a week. Introduce them at a time where you can actually observe the child. No, we're going to feed him, observe, let him play for an hour, and then go on the rest of the day. So introduction of cow's milk. I mean, majority of kids, by the time they do get to the office, the parents have introduced something. They've introduced yogurt, labna, anything that's cow's-based milk. Again, you want to do it at 4 to 6 months. And the key is you don't need a lot of it. The أكبر غلطة الأهالي بيفتكروا إن إحنا you have to feed them, a full cup of yogurt or a full, no. The gut needs to see it. The gut needs to know it, to tolerate it. But even a little amount and be consistent with it. The other thing too is that if you suspect a food allergy, you can refer to pediatric allergy or pediatric GI, because a lot of the times if it's very mild, we actually start them on the milk ladder. So for patients with non-IgE mediated cow's milk protein allergy, which are the classic patients, blood, mucus in the stool, generally we start around 9 to 12 months. Now the ones with IgE mediated, you can actually start a little bit earlier as long as it's mild. These are the 2 milk ladders that I used to use. I used to use the UK one, but ابتديت أحس إن هي it's not culturally relevant for some of the patients I see. Shepherd's pie, scratch pancakes, حاجات مش مفهومة كده. Canadian milk ladder, maybe I'm a little bit biased, but this was created by some of my colleagues in British Columbia, and this is the one that I actually use for patients. I use it for all my Middle Eastern patients, and you can shape it in any way, which form you like, because there's always going to be something culturally that's going to be baked, something that you can pan fry, etc. So who is this appropriate for? Non-IgE mediated milk allergy, the IgE mediated, and again, remember the 4 A's. So age less than 6, asthma, so the patient preferably no asthma or has to be very well controlled, no history of anaphylaxis, adherence. The parents have to adhere to actually introducing the food and be consistent. Because if you introduce the food and you forget about it, it defeats the purpose. نفس الحاجة with egg. The biggest mistake I see, yes, we introduced egg yolk, we introduced egg white. No, you introduce them together. The egg yolk and the white should always be introduced together. And again, for children that have a mild egg allergy, I do start them on the egg ladder. Again, when you bake a food with either egg or milk in it, heat denatures the protein, so it's more tolerable for the gut. Introduction of sesame, I won't get in too much about, but I've seen a lot of sesame allergy. Introduce it early. Tahina, يحطوها في any types of food. Again, kids, it can be a little bit tricky because kids with IgE-mediated sesame allergy can actually tolerate sesame seed, okay? Because remember, that sesame seed is in an envelope, goes throughout the digestive tract, and is usually pooped out, versus ground tahini. Peanut. You guys, in Gideon Lack's study, they were using peanut puffs, and طبعا بعد كده worldwide, people were trying to find peanut puffs. احنا في كندا كنا قاعدين contacting companies in the UK, etc. And then when I was here this summer, I noticed Abu Auf has peanut puffs. So these are actually amazing, and so many people would kill to have this. So this is a paper that we actually published last year with the group in Toronto, the Journal of Allergy and Clinical Immunology, showing that even that kids that eat these peanut puffs, small amounts of peanut puffs, can actually tolerate a large amount of peanut, and these were IgE-mediated allergies. Legumes, so things like lentil, ats, this is a very big part of the Arab culture, and tree nuts. So going back to just our case presentation for just 1 second. So we actually, this is what we did with him. We controlled the eczema. I asked mom to continue breastfeeding, but mom was actually pregnant. فقالت لي, you know, I want to stop actually breastfeeding. So we did switch him eventually to an amino acid-based formula that did have probiotics in it. At 6 months, she brought him back. He was diagnosed with an IgE-mediated allergy. We did skin testing, which was positive. His IgE was a little bit elevated as well. Milk introduction, so this is a Lebanese family. أول حاجة الأم قالتها لي ممكن نبتدي باللبنة. طبعاً I said, no, we can't start with the labna, but so we can end with the labna. And modifying the milk ladder to your patient is key. فهو next week, inshallah, he's coming for the labna, but he's so far tolerated up to step 3 and is doing great. We've controlled his atopic dermatitis, and I was very strict about mom, you have to introduce food. And what did I do? Mom's sitting in my office pregnant. You eat everything, okay, for that next child. Once that child is born and hits 4 months, we're going to introduce all of the allergens to him to prevent the food allergy. And then last but not least, vitamin D. Vitamin D is a very important protector in developing food allergies, and that's it. So I'm just going to leave you with this, and then just for my very last line. So lastly, what is old is new again. What our grandparents used to do was right. They used to introduce everything early. So let food be the new medicine, and let our medicine be food. Thank you.
شكرا جزيلا دكتورة شيرين على هذه المحاضرة القيمة. وقبل ما نفتح باب الدسكشن أحب أشكر أستاذتنا الدكتورة سناء على دعوتها الكريمة، دكتورة ياسمين والدكتور إيهاب، يعني الديناموهات بتوع المؤتمر الناجح ده إن شاء الله. أنا عندي بس استفسار. حضرتك قلتي إن الأي جي أنتي بودي فور فود إيليمنتس إز يعني inappropriate to be done. طب الأي جي إي maybe you have said it I missed it. Is it valuable إن إحنا نعمل IgE antibodies زي الراس تيست؟
طبعاً. So IgE, if we do suspect an IgE-mediated allergy and a true allergic reaction, it is appropriate to do the IgE. بس اللي أنا بشوفه إن they do panel of IgE testing.
Yes, في panels كتيرة جدا.
ده غلط. إن إحنا الdiagnosis بيجي منين؟ بيجي من clinical history. So أنا if the history is suggestive, يعني if the history is suggestive of an allergy, then I will do the IgE, and I will do specific IgE to specific foods. عمري ما هعمل الفود panel IgE. Why? إن أي نمرة عالية, parent is going to look at it, was going to eliminate it from the diet. المشكلة إن once you eliminate these foods from the diet, you're actually putting the kid at higher risk of developing a true IgE-mediated allergy.
Thank you. السؤال الثاني بس من فضلك، السيسمي ألرجي طالعة موضة اليومين دول في الويست. عندنا يعني في ايست ما بنشوفهاش كتير. Does it occur only in young infants ولا ممكن تحصل في elderly children and adults?
Yeah, that's a very good question. So طبعاً sesame allergy now by the FDA, it's named the 9th most common allergy. وهي فعلا موجودة actually in the Middle East. You do see it quite a bit in the Middle East, but we think it starts early in infancy. وبعدين حاجة تانية that you know, it was a study that came out by a group in Mount Sinai in New York, and what they actually showed was sometimes in kids اللي عندهم sesame allergy, they can still tolerate a little bit of the sesame oil, okay, عشان ما فيهاش البروتين, and they can actually maybe tolerate a little bit of sesame seed. So and I do have some sesame allergy patients. يعني طبعاً it's case by case basis. بس sesame allergy patients, which is very mild, بقول لهم لا كملوا sesame oil, because it's shown in the study that it can actually help tolerance later.
Thank you very much. في أي أسئلة تانية؟ اتفضلي. مايكروفون يا جماعة هنا من فضلكم. بس اللي يسأل الله يخليك introduce himself عشان نتعارف كده زيادة إن شاء الله.
دكتورة ناهد الغريب, you want to ask about you was thinking that the mother should continue breastfeeding, but she doesn't agree because she is pregnant. There is no controversy between pregnant and breastfeeding. She can.
طبعا لا هي ممكن, هي بس she's stressed out, She has a toddler running around. فهي طبعا ما فيش contraindication زي ما حضرتك بتقولي، بس هي دي البريفرنس بتاعت الأم. فإحنا as much as إن أنا I tried والله إن أنا push breastfeeding، يعني we did get to month 5 بس ده كان آخرها. وبعدين هي برضو although she was still breastfeeding كنا بندخل الامينو acid based formula intermittently along with the breastfeeding.
Any more questions؟ لأن للأسف الدكتور نادر فصيح ما قدرش يجي، عنده اجتماعات مع مستويات أعلى واحنا شايفينه في الفيسبوك ما شاء الله ربنا يوفقه، فبيعتذر عن محاضرة النهارده. أشكر البانل طبعا الكرام وأشكركم جميعا. We'll come to the next session إن شاء الله. اتفضلوا.